Have you ever felt a small change in your body and brushed it off because it seemed too minor to matter? Maybe a new kind of tiredness, a bit of indigestion, or a lingering ache that felt like nothing more than another sign of getting older. A patient of mine once shared a story just like this. She told me she kept waking up at night feeling unusually warm, and she noticed she was getting fuller after small meals, but she thought, well, this is just what happens in your 70s. I want you to imagine this for a moment. Imagine noticing tiny shifts in your body that don't hurt, don't disrupt your day, and don't feel urgent. They settle quietly into your routine until one day you realize they never went away. For many seniors, this is exactly how silent cancer signs begin to hide in plain sight. Fatigue that feels like normal aging, back pain that seems like arthritis, indigestion that comes and goes, a bruise that heals slower than it used to. These symptoms feel ordinary because cancer after 60 rarely starts with a dramatic signal. As we age, the immune system weakens, pain messages travel more softly, hormones change, and inflammation stays high. All of this makes early cancer signs blend into everyday life. They whisper instead of shout. The woman I mentioned was 76. She ignored her bloating, her new nighttime sweating, and her mild cough for months because none of it seemed serious. It wasn't until she became noticeably weaker that she finally saw her doctor. That moment, sitting across from her, reminded me of something important. Seniors aren't ignoring their health. Their bodies simply speak more quietly than they used to, and the signs are far easier to miss. Even doctors can overlook these early clues. Appointments are short. Symptoms overlap with common aging issues. Many older adults minimize discomfort or don't mention small changes because they don't want to seem worried. This makes silent cancers much harder to detect early, even with the best care. That is why today's video matters. Together, we will explore the silent cancer signs seniors never notice, why cancer behaves differently after 60, how normal aches can disguise deeper issues, and what subtle patterns deserve attention. Stay with me until the end, because awareness brings protection, and understanding your body is one of the strongest gifts you can give yourself. Before we move on, make sure to subscribe to Senior Health Daily so you never miss life-saving guidance created just for you. Why seniors overlook silent cancer signs. When we talk about silent cancer signs in seniors, we aren't talking about dramatic pain or sudden illness. Most of the time, the body doesn't raise a loud alarm. Instead, it offers soft whispers that are easy to chalk up to normal aging. That's why so many older adults unknowingly overlook the very signals that deserve the most attention. And it's not because they're careless, it's because their bodies have changed in ways they rarely think about. As we age, nerves lose some of their sharpness. Pain that would have felt intense decades ago now shows up as a dull ache, or sometimes nothing at all. That means early cancer discomfort, especially in organs like the pancreas or bones, may feel mild enough to ignore. Add in a weakened immune system, and the body simply doesn't produce the strong inflammatory flares that younger adults feel when something is wrong. Instead of a fever or sharp pain, a senior might just feel a little more tired than usual or experience a slight shift in appetite. Chronic inflammation also becomes a part of daily life for many people after 60. Joints are stiffer, digestion is slower, skin heals differently. With so many long-standing issues already present, new cancer-related symptoms blend into the background. It becomes nearly impossible to tell what's truly new and what's just another part of getting older. And then there's the emotional side. Many seniors are used to pushing through discomfort. They grew up in a generation that didn't complain, didn't overreact, and often viewed small aches as badges of strength. So when a lingering cough or unexplained bloating shows up, they simply think, this must be part of aging. Real-life moments make this even clearer. I've met seniors who apologized for wasting time, telling me about their symptoms, only for us to discover those quiet signs were the earliest clues of something deeper. Their confusion makes sense, and their humility is deeply human. Silent cancers hide behind these natural, age-related changes, And understanding why is the first step toward noticing what the body is trying to say. The most common silent cancers in seniors. When we talk about silent cancers in older adults, we are really talking about conditions that disguise themselves as everyday discomforts. These cancers rarely announce themselves with dramatic symptoms. Instead, they enter quietly, blending into the rhythm of daily life until they grow large enough to demand attention. By then, the picture is often more complicated. Understanding these hidden cancers can make all the difference. Take pancreatic cancer. Many seniors first feel it as a nagging ache in the back or a stretch of indigestion that doesn't quite settle. Nothing sharp, nothing urgent. Just a mild discomfort they assume is from lifting something wrong or eating too fast. But in reality, the pancreas is sending early messages, ones far too easy to dismiss. Colon cancer starts just as quietly. A little bloating after meals, a stretch of constipation, a bit of fatigue. All things older adults experience regularly. It is no wonder seniors often blame food choices or dehydration instead of recognizing that their colon may be struggling with something deeper. Lung cancer, even in people who never smoked a day in their lives, often begins with a gentle cough. Not a harsh, hacking cough, but one that lingers for weeks. Many seniors think it is allergies or dry air or just getting older. Yet it can be one of the earliest silent signals. Ovarian cancer in women over 60 brings subtle warning signs too. A little bloating, a sense of fullness, or mild pelvic pressure. Symptoms so easy to overlook that many women go months or even years before seeking help. Meanwhile, prostate cancer in men can start with urinary changes so slight they barely register. Getting up more often at night. A slower stream. These small shifts rarely feel like red flags at first. Blood cancers like lymphoma or leukemia often masquerade as innocent fatigue or a few nights of sweating. Skin cancers blend in even more. A new spot or a slow-growing patch can look like nothing more than another harmless age spot. These cancers do not hide because the body is weak. They hide because the symptoms mimic ordinary life. That is why naming them, understanding them, and noticing their earliest patterns becomes a powerful tool for seniors and their families. When we see these cancers for what they are, we give ourselves a chance to act earlier and protect the years ahead. Subtle symptoms seniors never notice. When I sit with seniors in my clinic, one of the most common things I hear is, "I didn't think it was serious. I thought it was just age." And I understand why. After 60, the body changes in gentle, gradual ways, and it becomes incredibly easy to overlook early signals that something deeper is happening. Silent cancers often whisper instead of shout, and their earliest signs blend quietly into daily life. Think about fatigue, not the exhaustion you feel after a long day, but a steady, lingering tiredness that doesn't match your activities. Many older adults blame this on poor sleep, stress, or simply getting older. But in some cases, the body is trying to conserve energy because cancer cells are pulling nutrients away. It is a soft warning that feels ordinary. Slow healing is another sign. A small bruise that takes weeks to fade, or a scratch that seems to linger long after it should have healed. Seniors often brush this off as fragile skin or thinning blood vessels, while the real issue could be connected to blood cancers or immune changes. A persistent cough feels just as innocent. It might start as a tickle you clear during the day or a little dryness at night. People chalk it up to allergies or cool air in the bedroom. Yet this mild, lingering cough can be an early clue for lung cancer, especially when it lasts longer than expected. Indigestion often gets ignored too. A bit of heartburn here and there, a bit of bloating after meals. These small discomforts are so common in older adults that no one thinks twice about them. But when indigestion becomes persistent, it may be signaling something happening in the stomach, pancreas, or colon. Night sweats are another quiet sign. Many seniors assume they are related to hormones, room temperature, or medications. In some cases, though, night sweats are connected to blood cancers developing in the background. Back or hip pain is perhaps the easiest to dismiss. Most seniors live with some degree of soreness from arthritis or old injuries, So when a new ache appears, it blends into the old ones. But persistent pain without a clear cause deserves attention. Skin changes are overlooked even more. A new spot or a slow-growing patch may appear harmless. Seniors often assume it is just another age spot when it may be an early form of skin cancer. These subtle signs are not meant to frighten anyone. They are meant to remind seniors that their bodies speak softly but wisely. When we learn to listen to the whispers, we protect ourselves far better than when we wait for the alarms. Why cancer behaves quietly. After age 60, as we get older, the body changes in ways that many people never fully realize. These changes are natural, expected, and part of aging with grace. But they also create the perfect environment for silent cancers to develop quietly without the loud warnings we expect. That is why so many seniors tell me they never felt anything alarming until much later. Their bodies weren't ignoring danger. Their alarm system was simply softer than before. One major reason is that cell turnover slows with age. When you are young, your body repairs itself quickly, replacing damaged cells with fresh ones. After 60, that process becomes slower and gentler. If abnormal cells start forming, the body may not correct them as quickly, and the symptoms that follow develop at a slower pace. This slow progression makes cancer feel less dramatic and more like ordinary aging. The immune system plays another role. By 60, the immune response isn't as sharp or forceful. It still works, but it reacts differently. Instead of launching a strong defense that creates noticeable inflammation or discomfort, it may respond in a muted way. Seniors often don't feel the sharp pain, fever, or swelling that younger adults feel, because their immune systems are quieter and more tired from years of hard work. Hormonal shifts also influence how the body communicates danger. Hormones that once regulated energy, appetite, digestion, and temperature begin to stabilize at lower levels. When early cancer affects these systems, the symptoms blend into everyday life. A small appetite change might feel like normal aging. A sudden drop in energy might look like a side effect of medication. It becomes easy to misunderstand what the body is trying to say. Then there is chronic inflammation. Many older adults live with inflammation from arthritis, past injuries, or metabolic changes. When cancer begins to grow, it creates new inflammation, but that signal gets lost in the already noisy background. The body cannot easily tell where one issue ends and another begins. All of these factors create a perfect storm, where cancer moves quietly, slowly, and often invisibly. The body's alarm system still works, but it whispers instead of shouting. And when symptoms whisper, seniors often assume nothing serious is happening. Understanding these natural aging changes is not meant to create fear. It is meant to empower. When you recognize that your body speaks gently, you learn to pay attention to the softer messages. You learn to trust your instincts, to notice patterns, and to ask questions sooner. Awareness becomes a powerful tool that keeps you safer at every stage of life. Symptoms that mimic normal aging. One of the greatest challenges seniors face is the simple fact that cancer often disguises itself as everyday aging. The symptoms do not arrive like emergencies. They show up slowly, quietly, and in ways that feel familiar. That is why so many older adults tell me they thought nothing of the changes happening in their bodies. They truly believed they were experiencing the natural progression of getting older. Take arthritis, for example. Many seniors live with joint stiffness or soreness, but when bone cancer begins, it can mimic those same sensations. The ache may feel deeper or more persistent, but because it resembles arthritis, people often wait months before mentioning it. They assume it will fade on its own or that it is simply another sign of aging bones. The same is true for digestive issues. Heartburn, bloating, or indigestion can appear harmless at first. Seniors may take over-the-counter acid reducers or blame spicy food. But sometimes, what feels like routine heartburn is actually an early sign of stomach or esophageal cancer. The symptoms overlap so closely that it becomes difficult to tell where aging ends and danger begins. Constipation is another common complaint among seniors. Medications, reduced activity, or dietary changes can all contribute to slower digestion. But persistent changes in bowel habits can signal colon cancer long before anything obvious appears. Because constipation is so common, many people delay getting checked. Fatigue presents its own challenge. Older adults often expect to feel more tired, especially after a busy day. But when fatigue becomes a daily companion rather than an occasional visitor, it may indicate blood cancer or another serious condition. Many seniors overlook this shift because it arrives gradually, and they adapt without realizing something deeper is happening. Even back pain can be tricky. It is one of the most common complaints in older adults, and it is frequently blamed on posture, exercise, or old injuries. But when pancreatic cancer or other internal cancers begin to grow, they often create a dull, persistent backache that seems easy to explain away. This confusion does not mean seniors are careless. It means cancer is incredibly skilled at blending in. The early warning signs whisper so softly that they are often mistaken for things people have lived with for years. Recognizing these subtle differences takes patience and awareness. It requires asking questions like, "Is this pain new?" Or, "Has this fatigue lasted longer than usual?" With small adjustments in awareness, seniors can learn to see the patterns that reveal when something deserves a closer look. Screening and detection mistakes. Seniors make one thing I've noticed after years of caring for older adults is that many seniors don't miss silent cancer signs because they are careless. They miss them because they underestimate themselves. They believe their discomfort is too small to mention, too ordinary to matter, or too familiar to worry about. And that mindset leads to some of the most common screening and detection mistakes I see year after year. The first mistake is skipping routine screenings. Colonoscopies, mammograms, prostate checks, lung scans, and simple blood tests often reveal problems long before symptoms arise. But many seniors postpone them because they feel fine, or because they assume nothing serious could be happening beneath the surface. Others delay exams because they dislike the preparation or fear what the results might show. Over time, those skipped appointments become missed opportunities. Another mistake is staying silent about new symptoms. Seniors often tell themselves they don't want to bother anyone. They convince themselves that indigestion is from dinner or that fatigue is from a busy day. They tell themselves a bruise will fade or a cough is just allergies. Meanwhile, these small changes continue for weeks or months until they become too obvious to ignore. A lot of seniors also rely heavily on over-the-counter remedies without realizing that painkillers, heartburn medications, or herbal supplements can mask early cancer signs. These products may relieve discomfort temporarily, but they can also create a false sense of reassurance. When the symptom disappears for a few hours, many people assume the underlying issue is gone too. Some seniors self-diagnose by saying, "It's just age." They learned to push through pain when they were younger, and they continue that habit into their 60s, 70s, and 80s. But age should never be the explanation for a symptom that arrives suddenly, lasts longer than usual, or feels different from anything they've known. Before we continue, if this video is helping you understand your health, please subscribe, like, and share Senior Health Daily. It gives us the motivation to create more life-saving content for you. Another mistake is avoiding doctor visits out of fear. Fear of bad news, fear of medical procedures, or fear of being a burden. But early detection works best when courage leads the way. The sooner something is found, the more options seniors have, and the better their chances of recovery. Recognizing these patterns is not about blame. It is about understanding how easily good people overlook important changes. Awareness helps seniors protect themselves long before symptoms become severe. Lifestyle habits that hide cancer signs. As we move deeper into this journey together, I want to talk about something many seniors never realize. It's not just the body that hides silent cancer signs. Sometimes daily habits, routines, and well-meaning choices unintentionally cover those signs even more. These habits don't come from neglect. They come from wanting relief wanting comfort, and wanting to keep life going as smoothly as possible. One of the most common habits is relying on heartburn medication every day to ease indigestion. A pill that calms burning or bloating can feel like a gift, especially after meals. But when indigestion returns day after day and is pushed away with medication instead of explored, it becomes easy to overlook what might be happening beneath the surface. Sometimes persistent indigestion is simply a stomach issue. Other times, it is the first soft whisper of something more serious. Painkillers create a similar problem. Many seniors use them to keep moving, gardening, cooking, or simply getting through a day when the joints ache. Pain relief brings comfort, but it can also blur the body's ability to communicate. When bone pain is covered up with medication, it becomes harder to notice when that pain changes or takes on a new character that deserves attention. Ignoring bowel changes is another habit that hides early cancer signs. Many people push through constipation or tolerate bloating because they believe it's a normal part of aging. They adjust their meals, drink a bit more water, or take laxatives. But if these changes become routine, the underlying message gets buried beneath quick fixes. Fatigue is perhaps the most misunderstood symptom of all. Seniors often shrug it off, telling themselves they simply didn't sleep well or had a long day. They rarely pause to ask whether the tiredness feels different than before or lasts longer than it should. This habit of normalizing exhaustion makes it easy for silent cancers to blend into the background. Let me share a story that stays with me. A man in his 70s used daily heartburn tablets for almost a year. He told himself it was just part of getting older. By the time he mentioned it during a routine visit, we realized those quiet symptoms were early signs of a deeper issue. His outcome improved because he finally spoke up, but his story reminds me how easily habits can hide the truth. These habits do not make anyone careless. They are human responses to discomfort. But understanding them is the first step toward revealing what the body has been trying to say all along. Real stories that inspire early awareness. I want to bring you closer to the heart of why this message matters, because information alone is not what changes lives. Stories do. They stay with us, guide us, and remind us why awareness is worth the effort. Over the years, I have met countless seniors whose experiences taught me more than any textbook ever could. One of them was a quiet, gentle woman named Margaret. She was 76, independent, sharp, and always quick with a smile. For months, she dismissed a mild cough that came and went. Sometimes it felt like throat dryness. Other times, it felt like seasonal allergies. She never smoked a day in her life, so lung cancer wasn't even a thought in her mind. When the cough lingered and her energy began to dip, she assumed she was simply getting older. Her family noticed she was slowing down, but she reassured them with the same words many seniors use. "I'm fine. It's just age." By the time she sought help, we discovered the underlying problem far too late. Her story still echoes in my memory, not to create fear, but to shine a gentle light on how easy it is for silent cancers to hide behind everyday symptoms. Then there was Thomas, a retired teacher in his early 70s. He was someone who always paid attention to his body. When he noticed a bruise on his leg that wasn't healing, he felt something wasn't right. It didn't hurt, it didn't grow, but it bothered him that it lingered longer than usual. Most people would have ignored it. He did the opposite. He mentioned it during a routine checkup. That small act of awareness led to early testing and an early diagnosis. Because he listened, treatment started before the disease could advance. Today, he is thriving, enjoying long morning walks and spending time with his grandchildren. His story reminds me of the power of curiosity and courage. I once met a daughter who noticed her mother's appetite had changed. Nothing dramatic, just a subtle shift. Meals her mother once enjoyed no longer appealed to her. Instead of dismissing it, the daughter gently encouraged her to see me. That simple observation led to life-saving intervention. Sometimes awareness doesn't come from the senior themselves, but from someone who loves them. These stories are not meant to frighten you. They are meant to lift you up, to show you what becomes possible when early signs are noticed rather than ignored. Every whisper from the body matters, and every moment of attentiveness can create hope where fear once stood. Practical steps for seniors to stay safe. As we reach the final section of this journey, I want to shift from stories and science to something even more important: practical, gentle steps you can take starting today. Silent cancer signs can be frightening when left unspoken, but when they are brought into the light, you regain power. Awareness is not meant to overwhelm you. It is meant to guide you. One of the simplest and most effective habits is keeping a small symptom diary. It does not need to be anything fancy. Just a notebook on your kitchen counter or a note on your phone. Write down when something feels different, even if it feels small. Maybe you felt more tired this week than last. Maybe digestion has been unpredictable for a few days. Maybe a mild cough shows up again and again. Patterns reveal far more than isolated moments, and you deserve to see the full picture of your health. Another step is allowing yourself to pay attention to changes that repeat. Seniors are often told to accept discomfort as part of aging, but aging should never mean ignoring what your body is trying to tell you. If something is new, persistent, or simply doesn't feel right, it deserves to be taken seriously. You know your body better than anyone. Trust that instinct. Talking openly with your doctor is another key piece of protection. Many seniors hesitate because they worry about seeming dramatic or taking up too much time. Please release that fear. Early detection thrives when small concerns are voiced without apology. Asking direct questions is not a burden. It is a form of self-care. Routine screenings also make a tremendous difference. Even if you feel healthy, screenings like colonoscopies, mammograms, skin checks, and blood tests act as a safety net. They catch what whispers cannot tell you. They catch what you cannot see. And finally, involve the people you love. Share any changes you notice. Sometimes a spouse, child, or friend may see a shift before you recognize it. Let their eyes and hearts be part of your protection. Health is never meant to be navigated alone. When seniors embrace these small habits, something remarkable happens. Fear turns into preparedness, confusion turns into clarity, and the body's quiet signals become invitations to act early rather than warnings that come too late. You deserve that sense of safety. You deserve to feel informed, supported, and empowered as you age. As we come to the end of this conversation, I want to leave you with something far more important than medical facts. I want to leave you with reassurance. Silent cancer signs are not signs that your body is failing or that you're running out of time. They are messages, gentle, quiet messages asking for care, attention, and compassion. The body you live in has protected you for decades. It has carried you through joy, hardship, love, loss, and everything in between. When it whispers, it is not trying to frighten you. It is trying to guide you. And that brings us to empowerment. When you understand your body's subtle signals, you take back control. Awareness is not fear. Awareness is strength. It is the difference between feeling helpless and feeling prepared. It is the difference between catching something early and discovering it too late. Every moment you choose to pay attention is a moment you protect your future. I also want you to feel gratitude for the remarkable vessel you live in. Aging does not diminish your worth. It does not erase your wisdom. If anything, it gives you a deeper understanding of what truly matters. Your body is not a burden. It is a storyteller. Its signals are lessons. Its changes are reminders to slow down, listen closely, and care gently. And finally, hope. It is never too late to act. Never too late to listen. Never too late to protect yourself. Early recognition can change everything at 60, 70, 80, or beyond. You still have time to stay aware. You still have time to stay safe. Thank you for spending this time with me. Senior Health Daily walks beside you with compassion, guidance, and unwavering support. If this message touched you, please like, subscribe, and share so more seniors can stay informed, protected, and empowered. You are not alone. You are part of a community that cares.